For me, being a citizen means living in a community and having a responsibility to that community. And fortunately, over the years, I've been in a profession where I can help people through healthcare. But as years go by, I'm now in a position where I feel I can help a whole community by establishing an outreach dental clinic. Community involvement for me stems from a few areas. One in particular is our family. We have a daughter in our family who has Down syndrome, and at the time that Susan was born, we knew very little about Down syndrome. Susan's been just a wonderful sort of addition to our family, and has opened up a completely new world of involvement in the community. Well, what helped me become interested in dental outreach was a conversation with a parishioner of ours who felt that there was a community in London, probably several of them, where they needed the dental care but could not afford it. And at the time, I approached the dean of the dental school at Schulich, and he agreed that it was about time that the dental school got involved in community outreach. The DOCS program at the Schulich School of Medicine and Dentistry stands for Dental Outreach Community Service. And it's a part of the curriculum where dental students will go into the community with portable equipment and treat people within their own locale. Now, the interesting part is that in doing this, what we found is we were just scratching the surface, and that more was needed than just that. That was sort of the basis of the development of our current project, which is to establish a dental outreach clinic in London South at the Glencairn Community Resource Centre. The population that we want to serve in the permanent outreach dental clinic is non-discriminatory. These would involve patients such as immigrants and refugees and those who are below the poverty line. And our studies showed that there are roughly 70,000 people that are at or below the poverty line in London. And this is an amazing number. And so we want to treat as many of those as we can. The planning of this clinic has taken probably 2 to 3 years. And when you go and seek funding for a project, it's good if you have a number of people working with you. We wanted to do the project properly, and so we hired one of the finest architectural firms in the city. So the next step was to go to a contractor, see whether we had enough money raised. That was the next shock. It turned out to be almost double which we had estimated. But it meant going out and doing two things. One, we had to look at our plans and see if we could cut them down a little bit without reducing service, and then also go out and solicit more money. So we managed to accomplish that, and we're all set to go, and guess what? COVID-19 came about. But unfortunately, it shut it down the day we were supposed to start renovations. So it's been one obstacle after another, but we've got the funding there, we're ready to go, and everybody's excited that we're in the middle of renovations now and can see the end in sight and the clinic opening. My personal role is to sort of oversee and make sure it gets going, but we also have a number of well-experienced dentists in town who have indicated they would like to volunteer help. I think that it's going to be a great service to the community, and I think it's going to be a great example to the rest of the province as to being able to utilize similar clinics to provide help to their citizens.